Hello, my name is Candace McFarland Proctor, and my Bio 204 presentation is about infections of the urinary tract. In this presentation, we'll talk about two types of urinary tract infections, cystitis and pyelonephritis. Each type of infection affects a different part of the urinary tract. But before we get into the parts that are infected, let's quickly go over the urinary system. Here's a quick look at the anatomy of the urinary system. As you may already know, the urinary system's primary job is to remove waste, regulate electrolytes, and maintain water balance in the body. This process begins with the kidneys filtering your blood and producing urine. Urine travels through the ureters to reach your bladder, where it's then stored. When you urinate, the bladder is emptied and the urine travels out the body through the urethra. As its name suggests, a urinary tract infection, or UTI, is an infection of the urinary tract, which includes anywhere from the kidneys to the urethra. UTIs are the second most common type of bacterial infection in humans. According to the National Institute of Diabetes and Digestive and Kidney Diseases, there are over 8 million cases of UTI in the United States each year. 75 to 90% of UTIs are caused by Escherichia coli or E. coli. Other bacteria can cause a UTI, but those cases are not as common. 5 to 15% of cases are caused by Staphylococcus saprophyticus, and even less common are cases of UTI caused by Klebsiella, Enterobacter, Clostridium, and Candida bacteria. E. coli is a gram-negative, facultative anaerobic, rod-shaped coliform bacteria of the genus Escherichia. It is commonly found in our lower intestines and feces. Most strains of E. coli are harmless, but others can cause urinary tract infections, gastrointestinal infections, respiratory illness, pneumonia, and meningitis. E. coli UTIs are caused by uropathogenic strains of E. coli, meaning they are pathogens of the urinary tract. Uropathogenic E. coli typically have P-type pili with a receptor for the P antigen. The P antigen is a blood group marker found on cells lining the perineum and the urinary tract. The P antigen is expressed by approximately 75% of the population. This is why UTIs are so common. When uropathogenic E. coli enter the urinary tract of an individual with the P antigen marker, E. coli binds its receptors to the P antigen of the host epithelial cell, enters and invades the cell, and replicates. So, how does bacteria enter the urinary tract? One way is for bacteria residing along membranes of the urethra to travel up to the bladder. Sometimes, but not as often, bacteria travels down the ureters into the bladder. This type of UTI is called cystitis, or infection of the bladder. Cystitis happens most often in women than in men. This occurs because a woman's urethra, compared to a man's, is shorter and closer to her rectum, where potential pathogens like E. coli exist. A combination of a short urethra and a close proximity to the rectum make it much easier for bacteria to reach the bladder. Cystitis in men is more likely to result from an underlying condition, such as an enlarged prostate, a prostate infection, cancer, or a urinary tract obstruction. Men who have sex with men are also more likely to develop a UTI than other men. Another type of urinary tract infection occurs when bacteria from an established infection in the bladder travels up along the ureters to the kidneys. This type of infection is called pyelonephritis, or infection of the kidneys. Pyelonephritis is not as common as cystitis, but when it occurs, pyelonephritis is much more severe. Recurrent or long-lasting kidney infections can cause permanent damage, and sudden kidney infections can be life-threatening, particularly if bacteria enter the bloodstream in a condition known as septicemia. Urinary tract infections don't always cause signs and symptoms, but when they do, they may include a strong, persistent urge to urinate, dysuria, meaning a painful or burning sensation when urinating, passing frequent, small amounts of urine, urine that appears cloudy, urine that appears red or bright pink or cola colored, which is an indication the blood is present in the urine, urine that is strong smelling, and pelvic pain. When an infection is spread to the kidneys, we often see additional signs and symptoms. They are the classic triad presentation of pyelonephritis, which includes a high fever, flank pain, and nausea that may or may not be accompanied by vomiting. Now, it's also very possible for an individual with a kidney infection to not have any of these signs and symptoms, so they could be asymptomatic, or they may not present with all the signs and symptoms together. So, how are UTIs diagnosed? Let's begin with cystitis. Clinicians will often make a presumptive diagnosis based on the patient's signs and symptoms. So, if a patient tells their doctor that they're having painful urination or they have frequent urges to pee but can only pass tiny amounts at a time, a doctor may suspect the patient has cystitis. But to make a definitive diagnosis, a urine sample must be collected and sent for urinalysis. Sometimes a culture is also performed. Urinalysis includes determining the color and clarity of the urine sample, a microscopic examination, and biochemical studies performed with a dipstick. The dipstick, like the one in the image on the right, checks for the presence of leukocyte esterase and nitrites. Leukocyte esterase is an enzyme of white blood cells, and this is present in the urine only when white blood cells are present, indicating presence of infection. So, a urine sample from a healthy individual should not contain any white blood cells. The presence of nitrite in the urine also points to the presence of bacteria because bacteria forms nitrite from the nitrate that is normally present in urine. Conversely, if there's no bacteria, the urine will be negative for nitrites. Sometimes a urine culture is performed to determine the type of bacteria in the urine so the doctor can prescribe the appropriate antibiotic. If a culture is not performed or if the bacteria cannot be identified, the doctor will prescribe a broad spectrum antibiotic. Doctors usually prescribe oral antibiotics for patients with cystitis. Some common antibiotics used for cystitis include trimethylprimasulfamethoxazole or fluoroquinolones, such as ciprofloxacin or levofloxacin. For pregnant women with cystitis, oral nitrofurantoin and cephalexin are good antibiotic choices for treatment. The diagnosis for pyelonephritis is very much the same as the diagnosis for cystitis. Presumptive diagnosis is based on clinical symptoms, but the signature symptoms of pyelonephritis, such as the high fever, the flank pain, and the nausea and vomiting, helps to differentiate between a bladder infection and a kidney infection. Also, like the diagnosis for cystitis, a suspected kidney infection will require a urinalysis and a urine culture. In some cases, a doctor may decide to use imaging tests, such as a CT scan, an MRI, or an ultrasound, to help diagnose an infection in the kidney. Imaging is often used in high-risk patients, such as diabetics, elderly patients, patients whose immune system is compromised, or patients with a history of kidney disease. Antibiotics are also used to treat pyelonephritis. The doctor will prescribe either oral or IV antibiotic therapy. Fluoroquinolones are usually the drug of choice for pyelonephritis, unless the patient is a pregnant woman or child. Kidney infections are very concerning in pregnancy because it could cause premature birth or preeclampsia. As a general rule, women who develop pyelonephritis during pregnancy are considered high risk. They are hospitalized for treatment and are given IV beta lactam antibiotics, such as cephalexin. If symptoms don't improve, the doctor may add a very strong antibiotic called gentamicin to the treatment. Once conditions begin to improve, they'll be allowed to leave the hospital and will be given oral antibiotics, such as nitrofurantoin for 7 to 10 days. Children with pyelonephritis can be treated effectively with oral antibiotics, such as amoxicillin clavulanate, cefixime, or Cedax. Urinary tract infections are the most frequent bacterial infection in women. They occur most frequently in women between the ages of 16 and 35 years old. At some point of their lives, 40 to 60% of women will have an infection. 10% of women will get an infection yearly, and recurrences are common, so many women tend to get a second infection or more within a year. UTIs occur 4 times more frequently in females than in males, and we now know this is because a woman's urethra is shorter and significantly closer to her rectum. Pyelonephritis occurs 20 to 30 times less frequently than cystitis, and this is because people are usually treated for cystitis before infection makes its way to the kidneys. However, as people become older, rates of asymptomatic bacteria in the urine increase. So we typically see higher rates of pyelonephritis in elderly women. Certain risk factors can increase one's chances of having a UTI. Poor personal hygiene, such as wiping from back to front after urinating or having a bowel movement, can lead to infection. This especially applies to women. Poor personal hygiene also includes holding in urine for an abnormally long period of time. Sexually active women tend to have more UTIs than do women who aren't sexually active. Having a new sexual partner also increases risk. Men who have sex with men are also more likely to develop a UTI than other men. Women who use diaphragms or spermicidal agents for birth control may also be at higher risk. After menopause, hormonal changes may lower beneficial bacteria responsible for fighting off harmful microorganisms in the urinary tract, again, making women more vulnerable to infection. Sometimes, babies are born with urinary tract abnormalities that don't allow urine to leave the body normally, or may cause urine to back up in the urethra, making them prone to UTIs. People who can't urinate on their own and have to use a catheter to urinate are also at risk of having UTIs. People with difficulty controlling their ability to urinate, such as those with neurological problems, or people who are paralyzed, also have increased risk. Urinary surgery, or even an exam of the urinary tract that involves using medical equipment, can cause infection. When a woman is pregnant, the uterus increases in size and weight, making it more difficult to completely drain urine from the bladder, thus making pregnant women more UTI prone. Kidney stones or an enlarged prostate can trap urine in the bladder and can also lead to infection. Diabetes and other diseases that impair the immune system also lead to a UTI. These are some ways to help reduce risk of urinary tract infections. Drink plenty of liquids, especially water. Drinking water helps dilute urine and ensures that you urinate more frequently. This also helps bacteria to be flushed from a urinary tract before an infection can begin. Urinate frequently and do not postpone urination. Holding it in when you need to go can help any bacteria that's present develop into a full-fledged urinary tract infection. Wipe from front to back always, especially if you are a woman. Doing so after urinating and after a bowel movement helps prevent bacteria in the anal region from spreading to the vagina and urethra. Empty your bladder soon after intercourse. Drink a full glass of water to help flush bacteria. Avoid vaginal dryness. Use a water-based lubricant when you have sex if you are prone to vaginal dryness. Urinate and wash immediately before and after sexual intercourse. Urinating will flush out bacteria that may be lurking in your bladder before sex or bacteria that may have been introduced during sex. And take showers, not baths. Showers help prevent bacteria from entering the urethra and causing a UTI. Baths do not. Avoid potentially irritating feminine products. Deodorant sprays or other feminine products such as douches and powders can irritate the urethra and possibly lead to a UTI. Change your birth control method. Diaphragms or unlubricated or spermicide-treated condoms can all contribute to bacterial growth. This concludes my presentation on infections of the urinary tract. I hope you all enjoyed it, and feel free to leave any comments or questions you may have. Thanks for watching.